5 signs your cat is sick and how to react. Cats are discreet and sometimes mysterious animals. Unlike dogs, they rarely show when they are in pain. This is a natural instinct. In the wild, showing weakness can be dangerous. As a result, when a cat is sick, the signs are often subtle but very real. Knowing how to recognize them quickly can make all the difference. Here are 5 important signs that should alert you, along with practical advice on how to respond. 1. Change in appetite. A healthy cat usually has regular eating habits. If your cat refuses to eat for more than 24 hours, eats much less than usual, or, on the contrary, becomes unusually hungry, this may be a sign of a problem. Why it matters. A loss of appetite can indicate an infection, dental problems, digestive issues, or even a more serious illness. In cats, not eating for too long can quickly become dangerous, especially due to the risk of hepatic lipidosis, a liver disease. How to react. Monitor how long your cat hasn't been eating. Check if it is still drinking water. Offer more appealing food. If it lasts more than 48 hours, consult a veterinarian. 2. Unusual behavior. Has your cat become more aggressive or irritable, unusually quiet or hiding, less playful or distant? A change in behavior is often one of the earliest signs of illness. Why it matters. A cat in pain may hide to avoid contact, avoid interaction, become grumpy due to discomfort. How to react. Compare with its usual behavior. Observe if it avoids certain movements, jumping, walking. Do not force interaction. Consult a vet if the change lasts more than a few days. 3. Vomiting or diarrhea. Occasional vomiting can happen, but be careful if it happens frequently. There is blood. It is accompanied by diarrhea. In these cases, it is not normal. Why it matters. It may be caused by food poisoning, parasites, infections, or a serious digestive issue. How to react. Monitor frequency. Check overall condition, fatigue, dehydration. Withhold food for a short time if advised. Seek veterinary help quickly if it continues or worsens.
4. Changes in grooming habits. A cat is naturally clean. If you notice, it stops grooming itself. Or, on the contrary, overgrooms excessively. Or starts using the litter box improperly. Backhand index pointing right. This is often a warning sign. Why it matters. It may indicate stress, pain, arthritis, injury, urinary infection, or a skin condition. How to react. Check the condition of its fur. Observe if it has difficulty moving. Keep the litter box clean. Consult a vet if the behavior continues. 5. Loss of energy or unusual fatigue. Cats sleep a lot, which is normal. But if it stops playing completely, seems weak, stays lying down all the time, backhand index pointing right, this may indicate a health issue. Why it matters. Lethargy can be caused by an infection, fever, an internal problem, or chronic pain. How to react. Gently try to stimulate it and observe its response. Watch its breathing and movement. Check if it is eating and drinking. Consult a vet if fatigue is unusual or persistent. Brain what to remember. Your cat cannot tell you it is sick, but its behavior can. Backhand index pointing right. Key warning signs: loss of appetite, behavior changes, digestive issues, poor grooming or unusual habits, excessive fatigue. Stethoscope when to seek emergency care. Do not wait if your cat has not eaten for 48 hours. Is vomiting repeatedly. Has difficulty breathing. Is extremely weak or barely moving. Has blood in stool or vomit. Red heart. Conclusion. Being attentive to small changes can literally save your cat's life. Even if some signs seem minor, they may hide a more serious problem. Backhand index pointing. Right when in doubt, always trust your instinct. It is better to consult for nothing than too late.